Do we have the recording started? Okay. Okay, thank you. I'd like to call the November 30th, which is actually our December meeting, to order of the Health Committee. We have all members present, so we do have a quorum, and welcome Ms. Klein for today, taking Mr. Robustelli's spot. We have minutes to approve from November 2nd. Do I have a motion? Motion by Chung, second by Martin. There's George. Now we see you, George. Roll call, Ms. Morlock, or any changes or additions or corrections, I should say, before I go for roll call. And seeing none, then we could do roll call.
Thank you. Member Klein?
Abstain.
Sorry. Member Chung?
Yes.
Member Gordon?
Yes.
Member Wentz?
Yes.
Member Martin?
Yes.
Member Metzger?
Yes.
Chairman Schaefer?
Yes. Minutes have passed. Do we have any members of the public for an appearance today? No members of the public. Okay, so then we'll move on to departmental matters. First up is
Susan, my screen is all locked. I'm going to go out and come back in. So just so you know, for some reason, everything is locked. I can hear you all, but I can't see anyone. All
Okay.
right. I'm going to go out and come back in. I'm just going to go ahead and come out. I'll come right back in though. All right.
okay. First up is Suzanne Scott from the Adult Detention Medical. Suzanne? You have your regular,
Yes.
You don't have any items for action today.
No.
So you have your report. Is there anything
Yes.
that you want to point out or make a comment about?
No, not particularly.
Okay. Does anyone have any questions for Suzanne from the committee? Anyone? Okay, well, that was easy. Thank you.
Thank you.
Next is Jason Tabb from Juvenile Detention Medical, or Juvenile Detention.
Good afternoon.
Hi, you have your report too. Anything that you want to make any comments about?
I don't believe so. Looks like business as usual. I'd be happy to answer any questions if anybody has any.
Okay, any questions for Mr. Tabb? Okay, hearing none, we'll just keep moving right along. Next up is Ms. Edens from the nursing home, and we do have an item for action here. Request approval of the McLean County Nursing Home 2021 private pay rate. Is there a motion? Motion by Metzger, second by Klein. And I'll let you explain this.
This is a 3% increase. When I did a comparison to the area homes, we're still, kind of under, not a lot, but a little bit. But I do think moving forward, this will certainly help with some of the increased costs that we've had this year and moving into next year. So.
Okay, are there any questions from the committee? Member Klein.
Yes, thank you. Hi, Ms. Edens. I have just a couple questions about this increase.
Okay.
So I suppose I'm concerned about the impact that this might have on the private pay residents of the facility. I know that that's a small number in the overall scheme, but have you talked with anyone or done any research about how this might affect those residents who do go through private pay?
I have not talked with the current residents here yet. Wanted to get approval first, and then would certainly reach out to them and just kind of explain to them, why. Most of them are pretty understanding, though. When you tell them, they know that costs are increasing everywhere, and they know that we are still cheaper than a lot of other places. So,
Sure. Sorry, Ms. Metzger.
oh, is that yours or mine?
That's Ms. Metzger's, I think. So I did, have you factored this increase in the budget that was approved just a week or so ago, or is this new funding that wasn't included?
No, it was factored in.
It was factored in.
Yeah, I mean, we took it in consideration that we would probably have to do that anyway. So when we did the budget, we accounted for that.
Thank you.
Thank you.
Yeah, and just about every year we increase that about 3 to 5% on that, just to keep up with costs and doing the comparison with other nursing homes in the area, so that we are still under their, a lot of times, most of them, and maybe all of them, I'm not sure, under their rate, so that we're not as expensive as them. So, any other questions? Member Gordon.
Thank you, Madam Chairman. Ms. Edens, I'm wondering if there might be, I have some concern about the impact on the residents as well, and as I'm sure we all do. I guess one question is, will this increase bring us in line with other nursing homes with which you've made comparisons?
It'll be closer, yes. It will be, we'll still be under a couple of them, a couple of the more upscale facilities in town, but there's still a couple that are going to be below us. But they're smaller homes.
My other question has to do with the possibility that we might be able to phase this in. Rather than boosting it at 3% now, maybe 1.5% now and 1.5% 6 months in, to see how the revenues are coming in, and more to the point, how the budgeted revenues compare with the expenses. I'd like to think that going into 2021, having had the expenses, obviously, that we've had in 2020, maybe 2021 won't be as bad.
I hope not. I hope you're right. And then as far as doing it at 1.5% each time, that's certainly fine. However, I've just found in past experience that if you increase it one time, yes, sometimes they get a little upset. But if you increase it 2 times, they don't care if it's 1% or 10%. They're going to get upset. So just checking from a couple other facilities that I had done a price comparison with, they had increased theirs 4% 2 times last year. Or this year, 2020. So that really made a big difference, with them. Now, I certainly don't want to do that, of course, but we do have to, take in consideration that, with the industry trends and the area competition, we do have to stay competitive. And I think, I don't think 3% is way out of line. We're not going to be the highest and we're not going to be the lowest. So that's certainly, the board's call. If they would like me to do the 1.5, I will certainly do whatever that they need me to do.
I understand your point about 2 increases in the same year as opposed to 1. Okay, thank you for that. Thank you.
Thank you.
Any other questions? If not, Ms. Morlock, please call the roll and the chair will vote.
Member Klein,
Yes.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes, motion passes. And then you have your report. Is there anything you would like to highlight, talk about?
No, just, we'll kind of give you an update. I sent this in and at that time we did not have any COVID cases. We currently have 5 residents that have tested positive for COVID, one being only one with symptoms. We do have our COVID unit open. Actually, all of them are doing great and we haven't had any issues. In fact, they all should go back to their regular rooms this coming Saturday. But just wanted to keep you abreast of that we've had, 2 more employees and I knew it was just a matter of time, but was hoping. And still, we're diligently doing the testing as CDC recommends and of course the county and the state health department. So we're testing employees 2 times weekly and residents once weekly. And the residents testing will stay once weekly until COVID's all gone out of the building. So I just wanted to let everybody know that. Does anybody have any questions about that? About anything that we're doing or?
Just for clarity, you said 5 cases, 2 are employees, 3 are residents?
No, 5 residents, 2 employees.
So 7 in total.
Sorry,
Okay.
7 total, yes, I'm sorry. Yep.
And only one has symptoms? Is that what you said?
Yes, and he started off with symptoms with a fever actually, and that's since broke ever since he went down to the COVID unit. So he really isn't having any symptoms anymore either. So it could have been, he's got a couple other core morbidities. So it could have been from that, but we didn't want to take a chance and he was fine with going down there. So we just went ahead and took him down. And so he's ready to go back to his regular room though. Although they do like the one-on-one attention that they do get down there, but.
Member Chung.
Thank you, Chair Schaefer. Thank you, Ms. Edens, for your report. I guess I have a couple questions. One of them is that because I guess since there's only 2 employees that are affected right now, you haven't had any problems with sort of people covering shifts or having enough employees to cover, other people's duties as they're out.
Well, it's funny you bring that up. Yes, we have. We have employees that all of a sudden have symptoms. So, they have to get tested here regardless, or twice a week. They don't have to get tested here per se, but they do have to get tested twice a week. Once an employee, according to IDPH, once they've tested positive, they can test positive for up to 90 days. Now, those employees that have already tested positive they can come back and say they're positive as much as they want, but they can come back to work. So, and they can also work with COVID patients because they've already been tested positive. So to answer your question, yes, we've had a little bit of difficulty with that and my management staff has done very well. In fact, my DON is on the floor as a CNA tonight. So everybody's just kind of pitching in, doing what we can. I've got dietary employees out passing trays and, everybody just kind of pitches in and just knows that we have to do what we have to do. So we're reaching out to the agencies still. Unfortunately, that was my goal by the end of the year and I'm not going to make it, but I'm still going to work on that. So until this COVID gets under control in our area, unfortunately, it's higher in the community. So once that happens, and everybody's out there at Walmart, so.
Thank you. And also my other question was that I know that you had opened up for visitors again. Have you stopped having visitors come in or are they still able to come in?
Only essential workers are allowed to come in. They can window visit, but the window has to be closed and they have to wear a mask, of course.
Okay. Well, thank you so much.
Thank you.
Any other questions for Ms. Edens? Okay, well, thank you very much.
Thank you.
Next up is Ms. McKnight, the Health Department Administrator.
Good evening. So we have no items for action this evening. So you have my report as well. Something to point out is on page 44 with the contact tracing work plan, just to bring you up to date on where we are with hiring individuals. We are still working on bringing on an additional 20 contact tracers. So we're bringing our total to 55. The benchmark, as noted in my report, is 124 And so including our 55 that are hired through the grant, and then around 40 student workers through ISU, and student nurses and our staff that are already trained to help out with surge capacity. That brings us to between 110 and 120. So I just wanted to bring you up to date on where we are with hiring individuals.
Thank you. Any questions for Ms. Klein?
Thank you, Ms. McKnight. I just wanted to ask a question about a statistic that you have on page 24 of the report. This has to do with COVID-19 related complaints that you had 89 in this interval and 426 in the calendar year. Are those calls to your department having to do with businesses and COVID practices? Could you explain that number a little bit?
Sure. So that's in the environmental health report. And yes, that is the complaints that they have received about businesses or different agencies from the public. So complaints that they have received about COVID. I think it breaks it down because they do respond to other complaints as well. So we've included COVID complaints and other complaints in the report.
Member Gordon.
Madam Chair, I'm going to defer to Ms. Chung because I have a follow-up that I want to come back to, and also a few other items that I want to raise. So I'll defer for the moment.
Okay, Member Chung.
Thank you, Member Gordon. I actually have a follow-up to Ms. Klein's question, so maybe we have the same question. So I guess I was wondering about those environmental health complaints. Are those, what's the word I'm looking for? It's sort of so the 429 or 426, is it 426 separate businesses, or could they be 426 about, 5 about this place and 10 about this place?
Yes, so it's 426 complaints, and that could be about social distancing, it could be about masking, and then also about the mitigations, with businesses being open outside of that, the different tier strategies.
Okay, thank you.
Okay, Member Gordon.
Thank you, Madam Chair. My follow-up was also on that 426. My understanding, Ms. McKnight, has been that when a complaint does come in, that there is follow-up each and every time. That the whole question of enforcement, authority for which I don't believe you have, it's more a matter of persuasion, encouragement, but at the very least responding to, for example, somebody calls in and says that I got great service at this takeout place, but 3 of the people working behind the counter were not wearing their masks properly. I've seen a few. I imagine we all have that. There's an employee who was working back in a hot area of the kitchen and has the mask on over the mouth but not the nose. Is the follow-up simply communication back to a business, letting them know what is expected and encouraging them please to comply? Is that the very least that you're doing? And my guess is it is, because that's my understanding.
Yep. So the first step is us reaching out to the business just to let them know that we received the complaint and to give them information about what the guidance is that they should be following. And then if there's additional complaints, then reaching back out to them and looking to have a plan of how they're going to comply with the guidance that is there. So we always follow up with complaints. And again, with that first step being the education and then further working towards voluntary compliance.
Am I correct that in most instances you've had some pretty good cooperation?
Mm-hmm. Yes, definitely.
I've heard of a few cases where at least 2 friends of mine have stopped going to one business because the owner doesn't believe in masks, period. When you encounter that, you do what you can and then respond to the complaint about the place down the street, and maybe they are more cooperative, more responsive. There are limits on the authority of the health department. I'm pretty sure that is a correct statement. Thank you for that. Madam Chair, can I follow, can I go ahead with the other questions that I have?
Sure.
Okay. Ms. McKnight, this may be one of those where I should know, but I don't. Has this plan for the COVID communication and so on, has this plan been formally adopted?
So yeah, we've been implementing this plan for a while. It's definitely a living document as things have changed. And there will be even a section that we'll be adding in here about mass vaccination. So things have changed and evolved with the pandemic. And so we'll be adding additional information in here. And also, again, you notice that the appendix was just the fall winter plan. So there'll definitely be a spring plan and probably a summer plan as well.
Well, the reason I asked that as much as anything is that I wasn't sure when it was drafted or adopted or when the implementation began, but there are some statements that do seem to me a little bit out of date. And if you're going to be updating it, the statements ought to be updated, and I'm sure that's your intention. On the second page of the plan, it's our page 31 in our committee packet, phase 4 revitalization. There's a sentence right there: the rate of infection among those surveillance tested and the number of patients admitted to the hospital continues to decline. Maybe before Thanksgiving that was accurate. I'm concerned now that that is changing, but from the standpoint of public information, I hope that those kinds of statements will be revised. There are a couple of other instances. If I can communicate to you directly after this meeting about where I found things like that, I'll be happy to do that. Would that be helpful?
Yes, and again, it's definitely a living document, and the definition for phase 4 revitalization, that is still the same. However, like you mentioned, it has changed, and the different tiered mitigation strategies that have been put in place, those have evolved and those have changed. Rather than pushing us back into phase 3, we just now go into different tiered mitigations in phase 4. So.
Right. There is also a section a little further back. I'll send. There are only a couple of things that I noticed in terms of updating a statement. I wanted to ask in the section, in the fall winter media placement plan on the second page, which is our page 38 in our packet, in the public transit. And I was first of all, before I ask that question, I was very happy to see all the different areas where where you're pointing to getting information out where the public will be able to see it, because I think that is terribly important. And I hope people respond and respond as fully as you hope that they will. In the public transit section on Connect Transit, in the last column under notes, still need to develop and approve graphic. I hope that is also now out of date, that it has been planned and approved.
I have not seen or approved a graphic at today, so.
As of today. All right,
Nope.
so that's still a work in progress. The last thing I had, and thank you for your patience and indulgence. The report, the updates, the most recent update in our packet at least was November 13th with the number of confirmed cases, which sadly that number has continued to increase. I'm hoping that that'll be updated as well.
Do you have a page number for that?
In our packets on page 42.
Okay, and so these are just samples of daily reports.
Okay.
And so the date, just happened to be the last one that I put in there for the example was the 13th.
That's fine. No, we see the updates daily in the paragraph and elsewhere online, and we're all looking forward to the numbers coming down. Thank you very much for the information, and I'll send along those 2 items that I had for you. Thanks. Thank you, Madam Chairman.
No problem. Yeah, and then those examples, if you recall, that Ms. Rodriguez is going to send us every week the weekly that has all these totals in here that weren't in the daily reports, so we are getting those weekly, so that on Fridays, I guess. So thank you. Any other questions? Member Metzger.
I'm really having connection problems, so I apologize. So if I jump in and out, I'm just warning you in advance. I do have a question about the mayor of Bloomington indicated on November 19th that there were funding problems, or not funding problems, that there were issues between the I think he said that the public health department was castrated by the state's attorney's office. And I guess what I'd like you, do you believe that this is an accurate depiction of the situation that is occurring?
No, so we feel very supported by the state attorney's office, and have engaged them in past and feel comfortable engaging with them if there are situations that need follow-up with enforcement of the emergency amendment. So, I definitely feel comfortable, feel supported by the state attorney's office.
Okay, thank you.
Are there any other questions? Member Chung.
Thank you, Chair Schaefer. This is not really a question. I just wanted to say thank you for starting to put the information about the hospital beds, especially the ICU availability, and the fact that that it's a little more clear now of how the percentage, because when you would see the numbers of how many people were hospitalized, but then you would hear that the hospitals were full, there was a lot of confusion in the community about why it was like this, and maybe it kind of painted this sort of incomplete picture of what was actually going on. So I really appreciate that is more clear now, because that the hospitals are actually treating patients from outside the area. So thank you for putting that in. I think that is extremely helpful. So thank you.
Anyone else? Okay, thank you very much. Next up is Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer. The County Administrator's Office has no items to present for action today. Our report on recent employment activities is found on page 51 of your packet, and I can answer any questions that you might have.
Any questions for the Administrator? Okay. Other business and communication? Anyone have anything? I will just say thank you, Mr. Gordon, for your service on the Health Committee, since this is your last Health Committee meeting. So you've asked lots of good questions and contributed quite a bit. So thank you.
Thank you.
Other than that, we have bills to pay, which the auditor has reviewed and recommended that we pay them, and they comply with all of our ordinances, resolutions, and policies. First is the Board of Health has a prepaid total of $407,007.80. Have a motion? Motion by Martin, second by Metzger. Is there any questions? If none, Ms. Morlock, please call the roll.
Member Klein,
Yes.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Martin,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Next is Developmental Disabilities Board has a prepaid total of $2,577.62. Motion by Gordon, second by Chung. Any questions? If not, Ms. Morlock.
Member Klein,
Yes.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Nursing home has a prepaid total of $226,989.44. Motion by Gordon, second by Klein. Any questions? If not, Ms. Morlock?
Member Klein,
Yes.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes, and that one passes. And so the last is jail and JDC Medical, which has a prepaid total of $55,492.04. Motion by Chung, second by Martin. Any questions? If not, Ms. Morlock.
Oh, I'm so sorry. Hang on one second. I grabbed the wrong sheet. I grabbed a transportation one. Member Klein,
Yes.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger. Did she say yes? Okay. Chairman Schaefer,
Yes.
thank you.
And with that, I don't think we have anything else, so this meeting is adjourned. Thank you all.
Thank you.